New at 11, a local county is one of the hardest hit areas when it comes to the opioid crisis, prompting more than 1,000 lawsuits against drug makers and chain pharmacies.
I-Team investigator Kylie McGivern discovers where the overdose death rate is higher than the state average.
It's crazy.
US 19, a major opioid artery pumping drugs into communities along this main highway in the Tampa Bay area. Ground zero for Pasco County's opioid battle.
It's almost like a war. In the Hudson US 19 corridor, that is one of the areas where we see a significant number of overdoses and overdose deaths.
All you do is see people up and down 19 walking and riding bikes, and usually it's because they're trying to get their fix on. And
Tara Minnelli struggling herself.
21 years old, I was first prescribed Roxycodone 30s.
Addicted to opioids for the last 8 years.
I've died from fentanyl twice, and they brought me back. I'm lucky to still be alive right now.
Sir. The number of drug overdose deaths in Pasco County, 30% higher than the state average, according to the CDC.
We cannot arrest our way out of this problem.
Captain Mike Jenkins with the Pasco County Sheriff's Office says the state's work to shut down pill mills and prevent doctor shopping helped.
But it created a void. In creating that void, many people turned to other drugs, such as heroin and fentanyl. Our deaths that year in 2017 actually matched the same number of deaths that we had during the pill epidemic in 2011.
At least 165 people died from drug overdoses last year in Pasco County, the Sheriff's Department says. But the real numbers are even higher because the Sheriff's Office doesn't track cities with their own police department, like Newport Richey, where Jaron Hopper died of a fentanyl overdose last year.
He just became my Scooby.
His mother, Danette Hopper, mails out bracelets in his memory.
26 states so far.
Encouraging sobriety, sharing his story.
My son's addiction began when he was about 14 years old. Him and his friend got prescription pain medicine out of the friend's dad's medicine cabinet.
18 years later, his addiction ended with a phone call at 2:30 in the morning.
Sorry. And I said, "It's Jared." And he said, "Yes." And I said, "Is he gone?" And he said, "Yes."
Hopper says her son would fill some of his prescriptions at this Walgreens in Hudson. State prosecutors are now targeting this Walgreens, saying the pharmacy purchased 2.2 million opioid pills to fill prescriptions in 2011 alone. That's 15 pills a month for every man, woman, and child living in this town of just 12,000. The lawsuit State Attorney General Pam Bondi filed names Walgreens and CVS as well as other distributors and drug makers, blaming them for the contributions to the opioid epidemic, which killed 5,700 Floridians in 2016. And Florida,
there we go, hold on,
isn't alone. More than 1,400 local governments have filed federal lawsuits against drug makers and chain pharmacies.
In some respects, it's reminiscent of the suit that was filed against the tobacco industry many years ago.
Dr. Jay Wolfson, a health policy expert at USF, says it's unclear if Florida prosecutors will see the same success as they had against big tobacco.
I think that's more of a public relations gimmick, quite frankly.
But CVS and Walgreens, now on notice, facing serious accusations.
Knowing that the volume was so high that there had to be something wrong, that billions of dollars of opioid distribution in Florida simply didn't match up with medical need.
Walgreens declined to comment on the case, and CVS said the lawsuit is without merit. Back on the streets, the fight continues.
It's rough because it's everywhere.
The first opiate lawsuit brought by Cleveland and 2 counties in Ohio heads to trial in September. There's no trial date yet for a larger batch of lawsuits representing about 500 local governments, including Pasco and Pinellas. Lawyers for those cases tell ABC Action News they expect to add CVS and Walgreens to those court complaints. I'm I-Team investigator Kylie McGivern taking action for you.